Hi, my name is Rebecca Myerson, and I'm an assistant professor at the University of Southern California in the Department of Pharmaceutical and Health Economics and the Schaefer Center for Health Policy and Economics. So broadly, I'm interested in applying quasi-experimental designs to answer questions about health policy and how, in particular, policy changes can affect both health and behaviors. I have one paper that focuses on whether patients seek care after they learn about a previously undiagnosed condition, and another paper that shows that decreasing the price of screening, because it changes the composition of diagnosed patients, can appear to make measures of health system performance look worse in a misleading way. And I think this is important because of the large influx of new patients that have become diagnosed and treated for chronic conditions as a result of the Affordable Care Act and other related policy changes. In the food policy realm, I have one new paper that focuses on the impact of restricting trans fats in restaurants in New York City counties on cardiovascular incidence of cardiovascular events, myocardial infarction, and stroke. And I think this is a very important and timely topic because there will be restrictions on trans fats nationwide starting in 2018 that could have substantial public health implications. Another aspect of my research builds on my previous experience working in China, and this also uses geographic variation in policy to study the impact of children becoming left behind by their economic migrant parents on children's human capital development. So I look at this both from a theoretical perspective and also from the perspective of, again, policy. So how can a policy that affects the geographic distribution of funds available for children if they move versus don't move, how can that change family composition and therefore affect children's human capital? In much of my current work, I also collaborate with epidemiologists and medical doctors, which is something that I really value. And I think that there's not only in terms of sharing of expertise, but also I think there's something that we can learn from the epidemiological approach of following patients over time and tracking their risk factors that it actually merges very nicely with the economic approach of focusing on how patients make their healthcare decisions over time. My read of the evidence is that addressing information barriers and not just cost barriers will be important in creating a healthcare system that works for everyone. One reason I think this is important is because the Health Reform Monitoring Survey, looking at trends right before the health insurance expansions associated with the Affordable Care Act, found that a lot of the previously uninsured people had difficulty understanding key terms related to health insurance. So as a result, it may be really important to have these type of policies such as navigator programs, consumer assistance program grants that help people understand their health insurance options, guide them through those options on a one-on-one basis, and also deal with issues that arise after people purchase their health insurance. However, funding for these programs has really declined in recent years. This is one topic that I focus on in my research. What's the impact of funding that helps people select the health insurance policy that's right for them? And how does this, on a broader scale, affect the stability of health insurance markets by affecting the type of people who end up purchasing health insurance? And I think what we'll see is that the type of people, it can be a little bit different who enter the market as a result of resolving these information barriers versus resolving cost barriers. I think another area of research that's very promising is related to healthcare quality metrics. So in the healthcare field, there's been a trend of using pay for performance to improve healthcare quality, hopefully. And this can have unintended consequences, some other research has shown, related to how providers select their patients. So care needs to be taken in designing health system performance metrics, especially those used in pay-for-performance systems, that don't penalize providers for taking on vulnerable patients.